Talks with Industry Experts, an initiative by Mantra Labs and InsurTech 100 firm building products and solutions for the changing world. The outbreak of pandemic COVID-19 has brought about an unprecedented change in our lives. The pandemic is disrupting global supply chains and international trade. The world economy is heading towards a slowdown. Many industries have been hit due to this. The biggest impact of COVID-19 has been on the healthcare sector. Indeed, it has been a challenge for hospitals to deal with this crisis. So to understand the impact of this crisis in different sectors, we thought about interviewing various industry experts to get a sense of the current situation. In today's session, we will discuss the role of technology in combating current challenges faced by the healthcare industry and some possible mitigation strategies. Today, we have a very special guest from Hyderabad, Mr. Devanand Kolothodi. Mr. Devanand Kolothodi is the Chief Executive Officer at Aster Prime Hospital. He is an expert in healthcare management with more than 2 decades of experience in P&L roles, project management, higher education, administration, new initiatives, people development, operations, detailing, and business development. He has great insights of the Tier 1, 2, and 3 healthcare market and understands the intricacies of running a successful healthcare practice in emerging and rural markets. With a vast experience spread over 23 years in healthcare management, he has spent 11 plus years with one of the biggest and most professionally managed healthcare organizations present in India, Middle East, and Far East. He also mentors and coaches people, helping them in their professional development. In his free time, he enjoys blogging, networking, and also loves to travel, read, and cook. Mr. Devanand, a very warm welcome on behalf of Mantra Labs.
Thank you, Divya. Thank you, Divya. First of all, I thank you for the opportunity given to interact and share the insights.
It's a pleasure to have you today. All right. So, just diving right into it, understandably, many hospitals are reassessing their digital marketing strategy and budgets in the light of the uncertain economic situation. Most healthcare organizations can benefit from taking this time to strategize and plan for the future, rather than putting the brakes on. Can you share with our viewers some key insights into the changing patient behavior and steps you are taking to reach them?
Yeah, that's a very interesting question. The COVID has brought in such an unpredictability all these sectors, but we were thinking that healthcare, will be spared because basically COVID being a health-related, issue. We expected that healthcare will not be that much impacted. That was the initial thought. We may have more patients coming with COVID to treat in the hospital. That's what was the initial thought process. But unfortunately, it went the other way. What happened was that the COVID treatment, as we all know, that is limited to few government hospitals. And then there was a fear factor among the public, basically to use the private hospitals, for their routine or elective procedures. So this has brought a serious, issue in terms of revenue and cost for the private players especially. So now every healthcare player is looking at disruptive strategies basically to combat the situation. We all have to contain cost. We have to look at different ways of generating income or revenue. So there are multiple things that healthcare players are doing. Especially I'm talking on behalf of Aster. So what we are doing, especially for Aster, is for something, especially at Prime Hospital Hyderabad, is what I'm going to specifically mention. So what we have done basically is that we have reduced our budget focus on many ATL, BTL activities that we used to do, while focusing more on the digital platform. We also have moved into teleconsultation mode, which we have come out with a pan-India basis, Aster. It's Aster teleconsultation, which is available both in browser and app, which makes it easy for the patients to connect to any doctor in the Aster vertical. We have also come out with Aster Home Services. These all were the verticals which we were planning probably in a staggered basis this year, but then COVID brought all of this together. It really fastened the process. So that's what has happened. So home services, home ICU services, and we also have launched a microsite called One Earth, which actually helps the users to understand and understand the new way of normal, how to live in the new normal. It's a combination of psychological and motivational type of site on focusing on the health part also. We also have collaborated with Visa and came with a Serenity app, so this is actually, a lot of people, many of my friends also say that, working from home for so long, creates such a kind of a behavioral issue, or they even go into depression. So this kind of things are very much required to, cater to the new needs. And we have been also, through our Aster Volunteers platform, we've been conducting various webinars for the patient as well as to the other doctors and small nursing homes to, make them aware of the various things. So on a broader sense, these are the things that we are doing. The change in patient behavior basically is that now there is no income for the patient. So they also are very reluctant to take up treatment unless until it is really warranted. They are choosy now. So they know that, okay, they have to reserve their wealth or money or whatever they have, and then go only in case of dire requirements. That's the change in patient behavior that's happened.
Very true. Very true. As the point that you made, that even we also got a lot of insights that many organizations had these plans of, certain steps like health, services to the home services. And COVID has actually unknowingly accelerated these projects of various organizations. So I think that is one thing we can thank this pandemic. Yes. So now out of all healthcare functions, only 7% is spent on preventive healthcare, while more than 80% is spent on treatment and cure. Arguably, there is more funding for private large hospitals than there is for improving preventive health, public health interventions. So, what do you think? How can these gaps be narrowed in preparing the country for another pandemic? How will the healthcare landscape change beyond COVID-19?
Oh, that's a very broad concept that you're asking. Probably what I'm going to say is a bit controversial also, the thing is that, India has, as a country, has developed a lot. India is really booming. We know that our country is now among, the top brass, when even at least you consider that way, because of the leadership and other things. But at the same time, health has been neglected, especially by not the country, but the people of India. Health comes always.
Hello. Hello.
Divya, sorry, I think there was a disconnect in between. So I was just asking you the question, how many medical checkups you do in a year?
Okay. Sorry, I'm sorry. Actually,
no,
I forgot my. Yeah. How many medical checkups do I do?
Yeah, do you do actually in a year?
Quarterly, every quarter.
Every quarter you are doing, so you're a very responsible human being that way.
Yes, yes.
Yeah. Otherwise, Indians usually take health as the last priority. Nobody does check their health. That's one. Second, nobody thinks about wellness. They only think about illness, or they go to hospital only for getting treatment, not for health. So that's concept. There's a difference in the whole concept. Even though the healthcare players have been saying about health and wellness, people think that it is a method of marketing or getting more people into the treatment mode. It's not. Actually, it's not correct. We all are been looking at the wellness part. We have been trying to promote more health by doing medical checkups and all. But there have been a lot of anti-campaigns also, against the health checkups and other things. So there is a bit of controversy in that area. We may have to be more proactive in doing that. The concept is about a change in the mindset of the public, especially to think about more about their health rather than going to a hospital for treatment. Even for interesting factor, we just want to share with you, Aster as a company, we do a special campaign for our employees, which is called Treat Your Body Well. We want our employees to be keeping their health intact. So we do a lot of programs. We do assess their health and do a checkup, and then we put them on certain exercise regimes, diet regimens to keep them healthy. So the program itself is called Treat Your Body Well. That's the whole thing. But then future, you asked about the future, how to focus on such pandemics, which will be more reliant on the digital platforms, 100%. Algorithms based, artificial intelligence based algorithms will be there, home care. All these things will gain momentum, and those who are not investing really on these things will be left behind. There is no doubt about it. Even our chairman, Dr. Azad, some years back, 4 or 5 years back in a meeting, was mentioning that we should look at options of innovating every time, because OP, the outpatient department in a hospital, is going to be vanishing in years to probably a few years to come. He did not mean the corona or pandemic, but then he had that thing in mind. People may not come to a hospital for just to see a doctor. They may do it online. So we have to be innovative and move towards this industry now.
Certainly. I mean, this pandemic has actually accelerated digitization, and since there is very less physical contact, people will turn to digital technologies more. So coming to the pandemic, in the short time since the pandemic has begun, the impact of social distancing norms has changed our daily lives and routines, due to which services like remote consultations and telemedicine, as you said earlier, are getting more attention. So telemedicine is likely a permanent beneficiary of the pandemic, you could say. Do you think it will remain a key mode of healthcare delivery even after the restrictions are lifted?
If you ask me, yes. Personally, I believe that teleconsultation or telemedicine is going to stay. Obviously, because of 2-3 reasons. One, recently on the lighter side, there was a recent post I saw somewhere that
Hello.
Chief technology officers who accelerated the technology process in all the companies. So
I'm sorry. Could you? There was your screen just froze. Could you repeat the sentence again?
Yeah, I was just saying that I read somewhere recently that it was the COVID and not the chief technology officers. Healthcare.
One second. I'll just.
Moment they come out of the house is at risk now. Till we come out with a vaccine.
I'm sorry.
Disruption in voice? Sorry.
No, there is disruption in the internet. I'm extremely sorry, sir. Could you please? Otherwise, we won't get a profit.
No, that's fine. That's fine with me. I'm also seeing your screen getting frozen kind of.
Yeah.
So I was just saying that it was not the COVID. Sorry, it is not the chief technology officers, but COVID which has accelerated the technology initiatives in many healthcares. Even our chief information officer, Mr. Vineet, was saying that he wanted to push the telemedicine and all, and he was pushing all the CEOs to do it. At the earliest, but then this really brought it like 3-4 months in advance. So, so there are certain things which are going to stay. I feel that telemedicine is something which is going to stay. But how we are going to, imbibe the good things about it and neglect the bad side of it. The bad side, I'll start with the bad side. Bad side is the patient definitely will miss the human touch. The doctor, touching. Or that empathy side of or the human side of it is lost in a teleconsultation. If it is a new patient, that will be a little easy because he has not seen the doctor. While for a patient who has already been with the associated with this particular doctor for a long time, you would always want the doctor to touch him and console him, and that kind of thing is there. That's why medicine is still having that particular impact in this particular area. So, but now patients also are aware that, lesser the exposure, lesser the risk. So they also are aware that they should also look at the different modes. So as a strategy, what we have done in Aster is that, all our follow-up visits, basically, we want to push to the telemedicine mode. All discharge patients, we say that all follow-up visits, you try to, take it digitally, so that you need not to travel, you need not to wait, you can just, see the doctor. In case of any complications or something coming out of it, they can always come to the hospital. Otherwise, they are normal, they are okay, just wanted to see the doctor and update their status, they can do it online. Also, another advantage is that, in areas where healthcare is not that much accessible. I come from a place which is called Wayanad. I was there for a long time. I came last year to Hyderabad. So Wayanad is a place where healthcare is still not accessible, even though Kerala has a very good model. So such places, telemedicine plays a vital role, especially in places with tribal colonies and all. Access of healthcare is very difficult. Also, what happens is that there are a lot of small nursing homes, clinics. Say some patient reaching this particular place, the doctor feels that there should be a opinion of a cardiologist. Now what he'll do, he'll just refer the patient to a cardiologist. So patient has to again travel to another hospital and see a cardiologist. But then if the telemedicine is available, this doctor can connect to a cardiologist from his clinic and then connect the patient to him and ask, for clarifications or little more insights. So which will all help the patient in the long run and will reduce the cost is what I feel, and more convenience.
That is a very excellent example actually that you pointed out, which can help people, like the second opinions that many patients require. So I have a small follow-up question over here. Apart from telemedicine, do you think that there are any other digitally enabled services that can potentially find greater adoption in the post-pandemic world?
You are asking about in perspective of pandemic or the general healthcare perspective?
I mean, if it is applicable, like in the earlier part of the conversation, you said in the new normal. So in the new normal, like how telemedicine will be a good thing. And so is there any other digitally enabled services that can be used? Or maybe it is something that many people in the healthcare industry wanted to implement, but have not been able to. So do you see that after the, the COVID situation is in control, and after the post-pandemic world, do you see if there is any scope for any other digitally enabled service like telemedicine?
Lots, you are asking basically a wish list,
Okay. Maybe you can perhaps name one or two.
Yeah, there are lots actually. So for example, a hospital, when everybody goes to hospital as a patient or along with some relatives, but it's when you are inside, you know how complex it is. There are a lot of things which is interacting with each other to give a particular care to a patient. So now, when you look at a specific process of taking a doctor appointment and going to a hospital, you take an online appointment again. Many times you have to go to a reception counter again to say that I am here. And then again, they'll take you to the doctor. Why? You can actually have a lot of technology in that, and bypass the entire process. Where the patient does a booking through online or telephonic, payment is made already, a QR code can be given, where it can be like a self check-in counter at the hospital, and then a navigation system takes the patient to the doctor. What I'm talking is not a dream no more, because it's like it's all available in the market as of now. So there are things like that which we can really, make it possible now because of the recent developments in the AI or the virtual reality or whatever name you talk about it. Again, there is I think healthcare providers already have a collaboration with a company for drones. Pharmacy delivery of drones is something which is emerging in India. So a lot of such things are going to come. Home ICU, till now we don't have that kind of home ICU support in India, which will definitely come in now. Cancer care at home, even the delivery home. It used to be in olden times. The females used to deliver at home instead. Probably we may go back to the olden times. The doctor and the nurse, the entire facility goes home and does the delivery there. That may be a time which will come very soon. The patient need not have to even come to the hospital. So there are things which are coming in and we don't know. And then there is infrared sensors which can do mass screening, and they give, data so that the entire data is captured in the system. You know who's having high temperature, and you can, screen such patients. So a lot of such things are coming in, and it's not only COVID, but also other than that, to improve the patient satisfaction. Such things are always required.
Very true. There's one more question I would like to ask here is that what are some new revenue streams that healthcare organizations need to embrace?
New revenue streams in the sense, this I told you, like Aster Prime Hospital, till now we are not ventured to teleconsultation. So that's a new revenue stream for us. Aster Home Care is a new revenue stream for us. Okay. The home ICU, we are initiating that as a new revenue stream. We are also looking at possible collaborations, like, a synergistic collaboration, say, for example, to reduce the manpower. There are firms, which can actually deliver me the same care and take my manpower in their account. Like, for example, physiotherapy. I am planning to now outsource my physiotherapy to a company which is an expert in doing that. Already my cancer care in my hospital is already outsourced to another company. So, so they also get a benefit of not, developing a full infrastructure for a cancer support. They can use my facility. I provide them the space. I provide them all the intensive care support. And then, you do a symbiotic kind of a relationship where both the parties get benefited. So these are all other revenue streams that you can look at, have more collaborations, more partnerships. And other than that, you can probably have a home care. Means I'm just not only saying the nurses, it includes the physiotherapy, includes the phlebotomy, everything comes under that. So it's a full revenue stream that we can think about in future.
Now, coming to operations point of view, digital transformation alone cannot help in preparing for an outbreak at this scale. The reality is that we also have to be prepared for the possibility of next pandemic wave. So in the era of patient empowerment, the patient calls the shots. They want access to better, faster, and affordable healthcare services. The pandemic itself is testing the digital readiness and operational resilience of hospitals in digitizing services and bringing innovation into healthcare. So what do you think are the operational challenges as far as digital capabilities go that hospitals are facing currently? And what do you think are the steps that are needed to take to bridge these gaps?
To tell you from the healthcare perspective, now hand washing has become a norm. This is something, all hospitals were driving to attain 100% hand washing among our staff. This is something which has been practiced in an industry which is healthcare in India. Outside India, yes, hand washing was there. Actually, in many countries used to practice. In India, now everybody does hand wash. But then now it has become a norm. So similarly, a lot of norms are going to change, which is going to be new normal, wearing a mask, social distancing. In a hospital, when you come now, every alternate chair is kept vacant. You can't make patients sit together. So that is going to become a norm. So these are going to be the operational challenge. How do I manage my traffic? If in OP I have this many number of patients, how I'm going to segregate them and make them all see the doctors of their choice in the prescribed time schedule of the doctor. So it becomes a huge challenge for any hospital. That is one. Second thing is that many doctors, the more you move into the digital side, many doctors actually do not like it. Even though some are very much, tech savvy, many people still feel that, they have to test the patient, they have to write a prescription. While they type the data into the computer, they feel that, they are focusing more on the computer rather than the patient. So now the digital prescription pads and all these things have come. Now a lot of such innovations have come in. So these are challenges to change that mindset and bring them to the digital mode. It becomes all the more difficult. They feel little, because they have learned that way. They've been studying also. They have been writing case sheets. Everything was handwritten. Now moving into the type mode, many people cannot type. Many people do not know how to use the software. So a lot of awareness has to be created among the doctors as well as to the patients. also. Why? Because patients also need to know that, this is good for me. The data can be retrieved at any point of time. This is in a cloud, I can retrieve it anywhere. I can take it digitally, less paper, so less pollution. So a lot of awareness things are there considering the technology advantages. At the same time, there should be a deliberate attempt to improve the awareness of the public as well as the healthcare players.
So I have a follow-up question over here. We have been speaking a lot about the patient experience. So both inpatient and outpatient treatment for all major non-communicable diseases, including emergencies, have declined. And going forward, as the country tries to resume the life in the new normal, industries like retail are experimenting with touchless user interfaces to boost the customer's confidence of shopping in store. So what do you think are the changes, if any, do you foresee to the physical patient experience?
There will be a lot of changes in the entire patient experience because, in February when the pandemic news came in, probably we are the first hospital to start the screening at the entry itself. I was surprised to see that our photographs was being shared in many media. We did not know that somebody had taken that photograph. So many articles I used to see our hospital photograph, the entry point is being circulated. So that was basically, there will be a screening at the entry. There will be a thermal scanning, temperatures will be recorded. Anybody has a different, readings or abnormal readings will be sent to a dedicated clinic. Then they'll be screened there. Everybody will be provided with a mask. They'll be told that, okay, you have to maintain a social distancing, you have to maintain a mask at all times inside the hospital. And then, if every staff is being, every day we monitor their temperature, we record it, any abnormal results we note it down. Sanitizers are kept everywhere, hand washing is kept everywhere, social distancing inside in every OP is maintained. When they go to lab also, there are a lot of PPEs, all staff are in different kind of PPEs. And when the staff is admitted for something, there are certain infection control protocols, disinfection methods. So a lot of changes are coming, even in the movement of materials inside the hospital, movement of staff inside the hospital, space for isolation. You have to also, control the rational use of personal protective equipments to reserve the, the entire thing, and also control on visitors' attendance. Otherwise, a baby born in a family, there'll be a lot of visitors coming to see the baby. Now, don't allow. So a lot of changes are going to come that way, especially on the more patients will face more of a kind of psychological rather than physical. That's what I want to say it here. Specific protocols for surgeries and procedures, and also a lot of triaging basically will happen. So, but as far as the care is concerned, I think all the private hospitals are ready to provide the care. We have, most of the people have been preparing for the last few months to, how to tackle this. And we have made 2 entries for the patients who are suspected cases. They'll be taken through a totally different route so that the other patients will not suffer or the staff will not get. Staff safety is also important. So all these things were not there initially. And for the first time in the history of healthcare, many departments are thinking of working from home. Healthcare has not even thought about that concept. Now HR, finance, purchase, IT, or many such departments may work from home. This is something which is a drastic change from what it used to be till now.
Exactly. Remote working is something that has been a very drastic change that has come across the world.
Yes.
So I would like, in our earlier part of the conversation, you mentioned about emerging technologies like AR and VR. So huge volumes of data are flowing into the cloud, not just from doctors' offices and imaging centers, but also from remote devices and sensors worn or operated by patients. So by harnessing the vast amounts of data and putting it into work in applications, it helps care providers to improve effectiveness and efficiencies. Do you see these technologies, augmented reality, virtual reality, artificial intelligence, playing a role in future digital healthcare in India? Can you share some examples of areas that Aster Hospital has begun experimentation or maybe perhaps implementation of these technologies?
as far as there are two questions. One, whether the augmented reality or the virtual reality whether it had an effect. Definitely yes. So, for example, a patient comes to a cardiologist. I'll just give you a live example. Cardiologist says that your blood vessels are blocked, and you may need an angioplasty. Patient does not know what it is. A common man may not know what is angioplasty. What is he talking about? So, if the doctor is able to actually show it in a three-dimensional form, this is what I'm talking about. This is your artery, and then probably they show it through the angiograms now. But then it can be more, three-dimensional with an anatomy of the human body, more color brought to that. Patient will understand it much better. Common man will be able to understand it better. Now then, there are a lot of systems which has come in, which is iBreast. There is a device which has come in which will detect the cancer. Breast cancer, especially among women. And then there are now new technologies which is coming in which will predict diabetes through eye scans. So a lot of such devices are coming in which can be used, as well as sensors which can alert the physician about any change in the dynamics of the patient condition. So a lot of such things are coming in. Aster as a group, yes, if we have now, as I told you, teleconsultation is one such big step that we have taken. Till now, we were moving the conventional consultation patterns. So teleconsultation or telemedicine is something which we have started recently. Home care also has been fully evolved now. Many markets are getting launched with home care services. Also, we have a research wing which has come in at Hyderabad. This is a research hub which has been created at Hyderabad. It's kind of an incubation hub where the organization has really invested in developing certain technologies or certain processes which can really simplify a lot of complex systems inside the hospital. So we are still at an early stage probably to say that we have started embracing fully technology, but then many of our hospitals has the robotic pharmacy. We have pneumatic chutes which transports the materials fast inside a hospital. We also have Da Vinci robots in many hospitals which have precision in surgery. So such technologies are already there, which is more on the clinical side. I'm talking about more of the process side. Clinical side, yes, we have a lot of equipments, techniques just come in, which is already being used. But many on the process side, this is a new process where patient is also really involved in the development of such things, which I think probably the COVID has brought that revolution, I think, which is going to stay, and we will be definitely going for more such measures.
Very interesting point that you raised over here about technology in the process and for patient. So I have a follow-up question over here. So let's take the patient discharge process, for instance. Transitioning a customer from inpatient to outpatient is a significant challenge for any hospital since it involves multiple departments. It takes the integrated view of hospital information systems, EMR, electronic medical records, inventory, billing, and real-time updates of treatment progress to facilitate discharge at the click of a button. So what is your experience in the transformation process and the ground realities of addressing this critical pain point?
Discharge taken, I tell you, discharge is the one major cause, worldwide, if you look at it, is one of the major cause of dissatisfaction among patients when healthcare is considered. When somebody gets all the treatment and they want to, if in a hotel, we just say that I'm checking out and then the bill comes 20 minutes and you're out. But in hospital, the moment doctor talks about a discharge, it will take 3 or 4 hours or 5 hours, probably the whole day is gone. So that happens. So it's a very difficult process for which every healthcare leader has a big challenge, because a lot of multiple complex departments are involved in the healthcare basically. There will be a lot of stock returns, whichever used for the patient will probably not used. So we'll return that and then adjust in the bill so that the patient will need not be abnormal, which things are not being used for the patient need not be billed to him. So we take back that, then it has to be accounted and reduced, and then bill has to be adjusted. And then the entire case file has to be audited before the discharge summary is prepared. Discharge summary has to be seen by the doctor. So these are the processes involved. So what we do now is that, many Aster hospitals, as I informed, there's a thing called bill buddy, which is basically, going to the room or going to the patient and informing about the daily bills. and settling it at their place so that the patient is having more comfort. So it will be like, it's not a technological thing, like probably it's a kind of movable, chaos which goes to the patient.
Change in process.
Change in process. So that happens, and we also keep a tab on the discharge process altogether. Like the previous day of discharge, the doctor will be knowing that, okay, the patient I am probably planning to discharge tomorrow. So our process actually starts the previous day. So the entire thing till the discharge medication, we prepare the entire data the previous day itself, so that when the doctor says discharge. So for example, Aster Prime, when I joined as a CEO, the discharge time was about 3.5 hours for a cash patient who is paying cash. Now we have brought it down to 160 minutes. So, it is definitely possible to, bring it down if you really focus. This 160 was about 4 months back. Now, our recent last month, before the COVID started in February, it was about 120 minutes. So we have brought it to now 2 hours. So 1 hour reduction has happened. So our target now is to bring it to 90 minutes. Okay, so every year we reset the targets and then work it out so that the process can be improved in much better ways. So discharge as a process, yes, if more automation can come in, so take for example, many things which can be automated, or certain things can be a template driven based on certain algorithms, and artificial intelligence can be brought into that. Of course, there will be significant changes, but I think.
Very, very true. That's a very excellent experience that you have shared about how we have reduced the time of discharge. So now coming to our last segment, as hospitals plan for the complicated return stage, like once restrictions are lifted, the volume of footfalls testing will gradually increase. What advice can you share with our healthcare leaders to prepare their organizations on the front line to manage these specific risks regarding employee safety, patient outcomes, etc.? What investments in remote patient monitoring or medical equipment, CRM systems, do you think that healthcare organizations should be making to respond to the return of the new
normal? As I told you, this is not going to be the usual way of working now. It is going to totally change. The first and foremost thing I want to say is that training. This training is the most important part for any healthcare establishment to come back to the post-COVID, process. The entire healthcare sector to sustain and to ensure the staff safety and as well as the patient safety, we have to train in the sense, train the staff to man the proper PPE and, take care of the patient with all the proper infection control practices. At every point, that has to be there. So we do not allow even an attendant to walk inside the hospital without a mask now. So it's like mandatory for everybody to wear a mask. And every point we have kept hand sanitizers. We encourage everybody to use that. And then such things are there already, but many hospitals will be practicing also. But then what makes probably a big difference is that, now sensors at the entry itself, checking everybody for their temperature is going to be a norm, which everybody has to take up. And also the patient, when they come in, they should not feel that they are in an alien world. The hospital which they used to come, now they see people all wearing full PPE and all, they can't see the face, it matters for a patient, especially those who are in the older generation or probably little elderly patients. They find it very uncomfortable. They can't see the face of the doctor, they can't see the face of the nurse. Even if doctor smiles and tells something, patient is not able to understand that. So that problem is going to be there. That's something which we'll all have to live with. But same time, there are things. See, now first of all, let us understand that COVID is here to stay till the vaccine comes out. So we have to live with it till either the vaccine is coming or a herd immunity is acquired. So we have to now understand and live with it and try to take in cases where isolation, wards or rooms or areas have to be developed, and then proper training to the staff on how to manage all these areas, and proper, basically it's a safety. That is the most important part you have to really focus. Otherwise, it's all the disinfection, infection control, all comes as a part of safety only. So safety of staff and the patient is what I would say the mantra to survive the post-COVID.
On that note, that's a very excellent way of putting it together. The safety, we all have to adjust to the new normal, adapt to it, and ensure safety and take precautions. Mr. Devanand, thank you so much for joining with us in this interview. It was a great pleasure interacting with you. Thank you so much for the wonderful insights that you have provided. I'm sure everyone would be very interested to listen to them. Thank you so much.
Thank you so much. Thank you so much, Divya, and for the opportunity. Stay safe. That's the most important thing here to do now. Probably you are all working from home, so I think hopefully you are all safe. But then have less exposure. By not relaxing much. The time we have to be more careful. Thank you so much.
Thank you so much, sir.
Bye.
Bye.